Anita Sam has always been the life of the party. So imagine her disappointment when she was told that she could not attend the New Year's Eve party that she had planned. Her life was hanging in the balance as her coronary arteries were severely blocked. She has high cholesterol, diabetes, and has survived stage 3 colon cancer. But these different ailments had never stopped Anita in her mid-40s from enjoying life. Until the day before New Year's Eve 2010. The chain smoker suddenly developed an onset of chest pains. She had 4 similar attacks, each 2 hours apart.
I can't describe the pain, it's just pain. The whole arm and your chest was all cramped up, you know. That's how I feel. And then the next attack I had was when I was having dinner with some friends. And I didn't feel well on the table, and I said, no, I really have to go and get this checked up again, you know. So I went to the hospital, and then Dr. Everyone was called to come in.
In Pathway Health, we are actually involved in many international trials with the various imaging and as well as the various university settings and overseas, whereby you're trying to still define the various strengths and weaknesses of each of these imaging modalities.
According to Dr. Hong, Parkway Health has a wide range of cardiac imaging tools to suit every individual patient's need. These technologies can detect even the smallest abnormalities in a patient's heart. They include the rubidium PET scan, which is a branch of nuclear medicine, the 320 slice or 64 slice CT scan, and the cath lab.
The 64 slice CT has been in the market for some time. It's a CT scan that you are able to acquire images of the heart over a period of 7 seconds. It's relatively reliable. I think in terms of 320 slice, it's a much improved version whereby we can actually acquire the image of the heart with an even larger spatial resolution as well as a bigger volume in a matter of 1 second. So in short, the patient actually only has to breath hold in one breath, and then we actually acquire the whole set of both the lung as well as the heart data set. So it's actually much easier and more comfortable for the patient, and the picture quality is way superior as well.
Dr. Hong decided to put Anita through a rubidium positron emission tomography or PET scan. The PET scan shows the blood flow of the heart at rest and at stress. The heart is stressed using a pharmaceutical agent which causes it to beat faster. This method is suitable for patients who already have pre-existing medical conditions like Anita. A PET scan reveals discrepancies between the rest and stress images, therefore helping doctors to pinpoint any blocked vessels.
I think the most important thing is actually the patient to discuss with the physician to decide what's the most appropriate imaging technology that's applicable for them, rather than taking on the menu to decide which is the latest and which is the fastest.
How will a rubidium PET help a doctor identify heart problems?
We inject rubidium to see what the REST scan looks like. Subsequently, we stress them using a medicine, whereby this is only for over a period of 4 minutes. And then from these image itself, we can compare what the image of both the stress versus the rest. From this PET scan, we can understand whether if it's a normal scan, which means the patient doesn't need to do anything, versus something that's abnormal. When it's abnormal, we can qualify whether it's mild, moderate, or severe. And from there, we can actually put it in a very clear dichotomous fashion to decide what's the best outcome for the patient. Hey,
Anita's wait for the results of her PET scan was unbearable.
Pain is gone. Okay, I just got your results from the PET center.
Is it bad? Okay.
Yeah.
Dr. Hong tried to break the news as gently as possible to Anita.
Okay.
The minute I looked at his face, I said, oh my God, doesn't sound like good news. And when he showed me all my tests, and he told me that, no, Anita, you have 3 blockage, bad ones. He said, oh my God, I'm gonna die.
So we're taking 2 sets of pictures. This was the first scan that we acquired from you at rest. And then the second set above is a replica, but with the medicine with challenging your heart. Okay, so you can see that when we did the first scan, when you felt comfortable, the blood flow was perfect. Red means good, However, when I gave you the medicine to sort of irritate your heart, you can see that your whole septal wall, from the beginning of the top of the heart, from the base, all the way coming down, there is a significant blockage. So I'm actually quite concerned that maybe there's more than one artery blockade. It could involve two or more vessels. So. You okay?
Actually, I told Dr. Hong I didn't want to do the procedure because I have this party going on because a new is coming out, and I was like, oh my God, can we wait? And thinking back, I said, no, I think my health comes first, party can wait. And I told him, yeah, okay, we'll go ahead with the procedure. And we did.
The procedure that Dr. Hong recommended for Anita to undergo was a coronary angiogram. Just 12 hours after she had her first attack of chest pains, Anita was lying in the catheterization lab. Commonly known as the cath lab, it's here that hearts are mended every day on the operating table.
Ready? What we do is we give a local anesthesia and we try to gain access to one of your blood vessels, either through your hand, called the radial, or the legs, called the femoral artery. We will place a long, slender catheter to the heart, and then from there we'll inject a small amount of contrast, called contrast dye, while the heart's beating. From there, the contrast is able to outline the coronary artery against the heart valves, the chambers, and the whole entire the heart itself. That is actually the gold standard for diagnosing coronary artery disease, and that's where we make decisions whereby we may need to do interventions such as percutaneous balloon angioplasty by placing a stent, versus identify things like multivessel disease where we may need surgical bypass graft called coronary artery bypass.
Before Dr. Hong's intervention, Anita's coronary arteries were 80 to 95% blocked. Now, after percutaneous balloon angioplasty, stents prop up the blockages in her heart. It wasn't quite how she envisioned spending her final moments of 2010. While the rest of the world partied their way into the new year, Anita spent it in the hospital with her close friends and family. Despite the more subdued celebration, the coronary angiogram gave Anita the best New Year present that she could hope for, a new lease of life.
I felt like a new person. I felt very energetic. I could do my walking, my running. I could go up the stairs. I don't feel tired. It's amazing what a total change after that angiogram. It was amazing, and I think he had done a fantastic job.
We found that there was a significant blockage in your second artery called the circumflex. Alright, this is the culprit that caused all the problem for you. You can see how tight it was, it's 95% blocked. And subsequently we have just placed 2 stents there, and you can see what the beautiful results we've got.
Oh my God, what a big difference.
Yep, so you're allowed to actually get back to your exercise regime, you got to cut down your salt, in terms of your diabetic control. I think that we have to tighten up the belt.
Yes.
Anita has made drastic changes to her life to keep her heart happy and healthy. She has since stopped drinking and kicked her smoking habit. Her new lifestyle sees her taking walks by the beach and watching what she eats. But so far, the sacrifice has been worth it. Besides her improved stamina, her cancer marker levels have also retreated.
I didn't expect this to happen to me. Because after going through my chemo for 9 months, and I thought that everything was okay after I found out that I was doing well. But I didn't expect this to happen. But it did. So it's about time now that I have to really take very seriously to my health.
Anita's condition is now stable. Having averted a potentially major catastrophe, her life expectancy is that of a healthy person's. Without Dr. Eric Hong and the Parkway Health medical team, Anita might not have made it into the new year. And that's why the multidisciplinary teams of specialists we feature in this season all want to do to give patients hope and a new lease of life. We've come to the final episode of this season. I'm Genevieve Wu. Thank you for watching.